we are hopeful that we can ride through this Omicron wave without having to tighten our measures.
Is this possible though? 70% of Singapore's daily cases are Omicron, but measures are in place to minimize the risk of a significant wave. And climate change is happening, but it's not all gloom and doom. We'll show you some easy ways to make a difference. It's 5:30 p.m. here in Singapore. You're watching The Big Story with me, Haryanto Diman. Subscribe to the Straits Times channel so you will not miss a single episode. Singapore is likely to soon see a significant wave of COVID-19 cases as the Omicron variant spreads through the community. But at a press conference today, ministers say they're hopeful that we can ride through this wave without having to tighten measures. So far, most of the Omicron cases have been mild, especially among those who have been fully vaccinated.
Since our last press conference, the number of Omicron cases rapidly, especially over the last few days. Now, the Ministry of Health can ascertain about 70% of daily cases to be Omicron, but in reality, the proportion is likely to be higher, perhaps close to 90% or more. Omicron has clearly dominated over Delta variant in Singapore.
With Omicron cases set to spike, more people may be absent from work in the coming weeks, leading to businesses being disrupted. The task force advising businesses, in particular those providing essential services, to ensure robust business continuity plans like split team arrangements.
The risk is that we have to be prepared that many people will catch the virus, it will be quite widespread, and they will not be able to work for a few days. The cases will be mild, but there will be a high rate of absenteeism in the workforce. So this is quite unlike the Delta experience, where we had a very sharp impact, people needing hospital care, severely ill, and then it overloaded the hospitals and the ICUs. It may well be that Omicron is different. We will not have that kind of a sharp impact on the ICU system, but many more people get infected, mild, but then there will be a high rate of absenteeism in the workforce, and potentially there will be an impact on business operations and essential services. And we have seen this happen in many other countries experiencing the Omicron waves.
The timing of the expected Omicron surge means there will be no changes to current safe management measures for the upcoming Chinese New Year period. Groups of 5 are permitted for social gatherings, and each household is allowed up to 5 visitors per day.
But so far, our experience with Omicron is similar to other countries that encounter it before us. It is a less severe disease. Nevertheless, we need to be psychologically prepared for big infection numbers, 10,000, 15,000, maybe and probably more. And we all need to stay vigilant and do our part to get ourselves vaccinated and protect the vulnerable amongst us. And if the situation in our hospitals is stable, we should ride through the Omicron wave with the current safe management measures through Chinese New Year.
We want to get an expert opinion on these developments. Joining me is Professor Teo Yik Ying, Dean of NUS's Saw Swee Hock School of Public Health. Welcome back to the show, Professor. Professor, changes to healthcare protocols, a simplified testing regime for VTL travellers, some of the announcements today. What do these illustrate about Singapore's management strategy currently?
Thank you very much for having me back. There are indeed some simplifications of the testing regime for the VTL travellers, but I would actually classify this to be rather minor changes rather than big changes that will really smoothen and facilitate hassle-free travel. Because after all, we still require VTL travellers to test themselves daily for the first 7 days after they enter Singapore, except that this no longer need to be supervised, nor do they need to submit the results. Also, should anyone test positive during this period, there is now a convergence to the same protocol as with anyone in Singapore who tests positive and has not been traveling. So basically, really looking at whether they are unwell or well, and to follow the respective protocols, 1 or 2, staying at home, monitoring the symptoms. So really, we are still very cautious and trying to pick up imported cases amongst VTL travelers as early as possible. But at least now we are more knowledgeable about the impact of the Omicron variant. We can now align our border control measures with our existing community protocols for anyone who have been testing positive. After all, as part of today's announcement, MOH did mention we will no longer differentiate between Omicron and non-Omicron infections. So if we look back at our heightened border measures that were introduced previously, those were specifically directed at trying to pick up Omicron and to minimize the impact of Omicron in the population. So now we can actually move to a protocol that is much more aligned with our general approaches to manage COVID-19.
Professor, you mentioned small changes. These tweaks, shall we say, are they enough to prevent a stricter tightening of COVID-19 rules further down the road?
Well, I actually did mention that this tweak's really fairly minor in nature, and I don't think it will really have an impact on the trajectory of our COVID-19 infections. What is clear is that Omicron, it's much more transmissible. So I do expect the number of infections in the community will increase steadily over the next few weeks, with or without today's changes. But what we do, however, need to continue monitoring is whether this increase in infection numbers will similarly lead to a surge in the number of hospitalizations and exert an increased burden on our hospitals and healthcare workforce. Now, the situation in Europe and North America, as we have seen in the news daily, is really a mixed bag. But all the data concurred on the fact that Omicron can increase the number of infections, but does not necessarily increase the pressure on the healthcare system. So whether we need to tighten COVID-19 rules further down the road, I expect this will depend more on the hospital situation, like what we've always mentioned, rather than really the number of infections happening in the community. And when I mention the hospital situation, we do need to be very careful that the present protocols for manpower management, especially in our hospitals, do not incapacitate our healthcare workforce directly. For example, if we start to isolate and quarantine many of our nurses and doctors simply because of their proximity or interactions with known cases, we may end up with a situation like in many of the countries in Europe or North America, that Omicron indeed drives mostly asymptomatic and mild infections that do not require hospitalizations. But our hospital or healthcare workforce comes under pressure because many of the healthcare workers are quarantined away rather than allowed to go back to work. So that's something we need to be very careful of.
So, Professor, on that, what would you suggest then for us to almost, prevent or not take that route of isolating our healthcare manpower?
So this is really where we have to understand that as part of living with COVID-19, the data clearly suggests that even with Omicron infections, fully vaccinated people, the problems of COVID-19 now really resembles that of a common cold or a flu. And if that is the case, we never really keep our healthcare workers isolated or quarantined away for a fixed number of period when they have a cold or when they have flu. We do watch out for whether they need to stay away with medical leaves or not. But there is no official protocol that says that suddenly an entire group of healthcare workers are not allowed to go to work. Because many of these healthcare workers, either they stay together or they do interact amongst themselves on a daily basis. So if someone does test positive, there is a real chance that the health risk warnings will be sent to an entire cohort of healthcare workers in the same section or same department, that you can incapacitate the healthcare workforce simply because of the protocols, rather than a genuine surge in the number of people seeking help in the hospitals. So that's something that we need to watch.
Professor, separately, the Health Ministry's daily updates will no longer differentiate between Omicron and non-Omicron infections, like you mentioned earlier. Case numbers will also include supervised ART positive results. What do you make of this new way of reflecting Singapore's COVID-19 situation?
So, two changes there that you have mentioned. The first is really the fact that we no longer differentiate between Omicron and non-Omicron. Well, I think that is the right decision, because in a matter of a couple of weeks, I actually suspect that almost all the cases in Singapore will be Omicron infections. So trying to differentiate or between Omicron or non-Omicron, I don't really see that there is any need anymore. Now, the second change that you talk about is that case numbers that are reported daily will now include supervised ART positive results. And to be honest, I'm rather surprised by this move to now count these cases from the ART test, because this actually appears to signal a regression in our strategy towards having this return to focus on infection case numbers again, rather than on the situation in the hospital. So I think there's some mixed signals being sent here. It is actually important to clarify first that this supervised ART positive results that we talk about are mainly those people who test positive with ARTs in healthcare facilities. So people who are seeking care in a healthcare sector, they are tested with an ART test kit, and subsequently these people test positive. So I can only interpret this from the perspective that this is going to be temporarily useful to correlate the infection case numbers and with the situation in the hospitals, because these people are the ones that are already seeking care in the hospitals and are testing positive. Now, at some point, we do need to differentiate between those people who are seeking care in hospitals for reasons because of COVID-19 infection versus those that are in the hospitals for reasons that are completely unrelated to COVID-19. But because as part of the admission protocol, they may be tested with an ART kit for COVID-19, and therefore they are found to be positive. But they are actually not in the hospital for COVID-19. So we need to separate these two groups of people, because really the interpretation is completely different. Now, in the long term, I do think we need to have a consistent approach in our transition planning to endemic COVID, whether daily case numbers will indeed still be relevant or no longer relevant, and we will not focus on it anymore. So I hope counting this ART positive results in a healthcare facility, it's really just a temporary measure and not a signal to return to watching daily case numbers so closely that a number of our public policies are decided on the basis of our daily case numbers.
Professor, as always, thank you for your perspectives. Professor Teo Yik Ying from the Saw Swee Hock School of Public Health at NUS. COVID-19 overseas, Malaysia's Health Minister Khairi Jamaluddin says from next Monday, January 24th, travellers who have received COVID-19 booster shots need to quarantine for 5 days upon arriving. In addition, they will need to take a PCR test 2 days before departure, on the arrival day and on the 4th day of quarantine, or go through a supervised rapid test on the 5th day. It's a 7-day quarantine for fully vaccinated travellers without boosters and 10 days for partially or unvaccinated visitors. Meanwhile, Malaysia's COVID-19 vaccination program for children aged 5 to 12 will begin on February 3rd. It will be a 2-dose regime of the Pfizer vaccine with an 8-week interval. Each dose is 0.2 milliliters and contains 10 micrograms of the vaccine, which is 1/3 of what is given to adults. Despite a record number of daily cases earlier this week, France will begin a gradual lifting of restrictions from February 2nd, made possible by the implementation of vaccination differentiated measures at restaurants, cinemas and other public venues. So, as a first step, there will be no capacity limits for concert halls, sporting matches and other events. And working from home will also no longer be mandatory for eligible employees, and face masks will not be required outside. Despite KTV lounges being banned since a circuit breaker in 2020, one outlet in BUGIS is still operating, albeit illegally. How has it managed to stay open and with its business thriving at that? Now you can watch the full inside look on the Straits Times' YouTube channel, but here's a snippet.
The KTV operates covertly by using a fire escape staircase. It leads to the KTV rooms. Hostesses use the staircase to move from one level to another. At the official closing time of 10:30 p.m, the shutters come down, but that does not mean that the party is over. When it is finally time to leave, patrons are ushered to the fire escape staircase, which can only be opened from the inside.
What can each of us do to fight the climate crisis? In this week's Asian Insider, we asked experts about the individual actions that can make a difference. Something that can easily be done using reusable bags, cups and cutlery instead of disposables. You could also try walking or cycling or using public transport instead of driving. And you can be a conscious consumer by checking if products come from sustainable sources. Let's bring in Assistant News Editor and Science and Environment Correspondent Audrey Tan. Audrey, the effects of climate change can be felt by all of us all around the world. How can an individual make a difference and how important is it to do it collectively?
Hey Jan, yeah, thanks for the question. So I think when it comes to talking about climate crisis, it's important that we all realize that the cause of it is largely state and corporate actors because of the burning of fossil fuels and deforestation. But of course, talking about like this scale of this problem can often be very disempowering to individuals. So we thought that, we could highlight various steps that individuals can take. And why this is important is because, as one of our interviewees did point out, governments manifest the political will of the people. Corporates respond to changes in demand from their consumers. So it's important that all of us start doing our part to kind of nudge the green transition along and make things to effect the change. But of course, that is not to say we are discounting the impacts that state and corporate actors should be able to act on the climate change by switching away from fossil fuels and to stop deforesting land and so on.
Audrey, besides doing something about it, talking about climate change is as important. Are you seeing more Singaporeans lending their voices to the discussion?
Yes, for sure. So, in that kind of board game theme that climate change editor David Fogarty and I worked on, we highlighted different steps that individuals can take to helping nudge the green transition along, starting from the very easy, low-hanging fruit like cultivating awareness all the way to speaking up. And when it comes to speaking up, having reported on the environment in Singapore for almost 9 years now, I would say that there has been like such a ground-up movement in so many different ways. Initially, there was a lot of talk from the nature community. There's a lot of activities in terms of creating awareness about wildlife. But now we are seeing other kinds of groups coming up, talking about climate change, climate crisis, and the young people recently, like just last week or just earlier this week, in fact, they did a report highlighting the links between the fossil fuel industry and their universities. So I would say there's really a huge groundswell now, ranging from all age groups. People often think the climate crisis is being spoken up by young ones, but that's not really the case. Coming across from all age groups, different types of environmental communities. So it's no longer just nature, but now it's also people that are looking at things like recycling, things at fossil fuel links. So there's definitely a huge momentum now from the ground up.
Audrey, always a pleasure to have you on the show to talk about this. Assistant News Editor and Science and Environment Correspondent Audrey Tan. For more ways you can make a difference on climate change, look for Audrey's articles at straitstimes.com/climate-change. You'll also find videos, interactives and explainers on climate change. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below. I'm Haryanto Diman. Have a good weekend, stay safe, and we'll see you next week.